Okay, so this video today we're going to talk about runner's knee. Runner's knee is super common. We see it a lot, especially in runners. And essentially, runner's knee is an overload of the tissue due to an increase in intensity, which could be over time, or it could be an increase in intensity in one specific time. So just recently had a client where they had been training for a marathon, but then they decided to do sprint training. Just that increase in intensity then started to cause this kind of runner's knee. So in this first video, what I'm going to do is talk about what it is exactly, some of the signs and symptoms, what's causing it, and then the videos after I'm going to talk about how we can go about kind of strengthening, stabilizing the knee and getting rid of that pain that you might have. So this is your knee joint. Essentially your knee just does flexion and extension. Okay, what happens as you do flexion and extension is your knee should glide up and down in the groove quite easily. Okay, there is a lot of load because obviously it's one of the joints that's taking so much load and so much impact. So the cartilage on the back of the kneecap is very thick, but with running, especially with marathons and things like that, it can become irritated. And there's a few different reasons that it can become irritated. One of them is just that general increase in intensity. If we're doing this constantly, and like I said, you're doing that 3, 4, 5 days a week when you're running, that can cause kind of irritation. But also, we see this a lot in people that go skiing. So if you're somebody that doesn't tend to do that much sport, and then all of a sudden you do 4 hours of just constant, skiing, and you're getting this motion, they tend to have that kind of issue as well. So some of the things that are causing it is, number one, if you are, so this is your quadricep, so this is the top of the leg here. If this part here and all the muscles that are joining are super tight, what can happen is it can restrict that movement a little bit, and it can almost push the patella down into the groove. That can cause irritation. Another issue that we can see is if we've got tightness in other areas. So maybe the inside of your thigh is a little bit tight on the outside, maybe you've got tightness somewhere else, it can kind of pull the patella off track a little bit. So as you are tracking up and down, it's pulling to one side, again causing irritation. Another reason could be that not so much the tightness, but it could be the fact that it's a little bit looser. And because you've got that instability, again, it's not kind of flowing up and down through that groove properly. So when we're tackling runner's knee, what we want to do is basically decrease all the tension and tightness around. We want to basically create stabilization, so almost strengthen the knee joint itself as well. And then we need to look at flexibility and mobility as well, so that we've got that nice kind of glide and that normal traction through the knee. So, what I'm going to show you first is how to go about releasing tension around that whole knee area using things like foam rolling and mobility and stretching. So when addressing runner's knee, one of the first things that we'll go to is to basically release as much tension as we can so that it's not constantly pulling on that patella tendon. So we want to try and release all the quads, the VMO, basically the whole lower limb, okay? One of the ways that we can do that is with something like a foam roller. So if you place the foam roller on the floor, what we're going to want to do is foam roll up through the quad, and then we want to try and get on the inside as well and on the outside on the IT band. So from here, you're going to place that underneath your knee and roll forwards, and then what you want to try and do is just kind of relax into it. You're going to get to certain spots where you'll feel it, like now, where you'll feel it really sort of burning. You want to hold it there for a second, try not to fight it. So when you're fighting it, that muscle's not going to relax around it and it's not going to release that tension. So you have to breathe, relax, and then kind of move through it, massage it slowly through it. What I see a lot of people do when they use foam rollers is they don't put enough weight on it and they just kind of roll super quick. What you want to do is take it nice and slow, find the spot, stop, and then gently roll out that one spot. Okay, so you're going to go all the way through your quad, And then what you want to do is try and get the inside as well. So if you lie on your side, turn your knee inwards, and you're doing the same thing again, rolling along the inside, up towards the top of your hip. Again, just finding all them spots, stopping where you find it, big deep breaths into it. Now, what's super, super tight on a lot of runners as well is this IT band. So, what we want to do to get your IT band is essentially side lying position, the top leg over, and then from here, you're rolling down the lateral side of your thigh. And again, this part's normally super painful, so find the spots, breathe. You might even find that the legs start shaking as it's releasing that tension. Okay, so that's one of the things that we can do to start relieving some of the pain that you're getting around the knee, and it releases that tension on that patellar tendon. The next video I'm going to show you, we're going to talk about flexibility and mobility, why it's important, and some of the things that you can do to prevent runner's knee. So in this part of the video, we're going to be looking at flexibility and mobility. Now obviously we've released the tension with the foam rolling, and now we want to try and basically get full flexibility through that joint, and also the joints above and below. So with the knee, essentially we've just got flexion and extension. Now what you might find, some people might not even have full flexion because their quads are so tight. So what we want to do is try and really stretch out the quads, the hamstrings, but then we also want to stretch out the hip and the ankle as well, so that we've got full mobility. Because obviously when we're running, we need that kind of full mobility through the hip, through the knee, and then also through the foot. So one of the best stretches that I find for everything, to be honest, hip and knee, is this one I'm about to show you, because the typical quad stretch is this, which is so easy because people, number one, don't push back enough, they don't push their hips forward, they don't tend to feel it. So you're really going to feel it with this one. So it's like a normal hip flexor stretch, but you're going to elevate your foot. So you're going to pop it on a chair, a couch, anything, drop the knee down, and you might find straight away, even from there, you're going to feel really deep stretch through the quad. So even in this position, again, try not to lean forward, keep your back nice and straight, and then you're going to feel the stretch when you push your bum forward. Push your hips through, you're going to feel that really deep here. Okay? If you want to get more of a stretch, you just twist your body across to the right, and then you're going to feel that going right through, up through the hip, all the way through the quad. Really, really, really good stretch. So doing these after running, holding for 30, 40, 50 seconds is good. And then switch on to the other side as well. That's going to do all the front. Then obviously we've got the hamstrings. A million different ways to do the hamstrings. So keeping the legs straight, pitching at the hips, popping it down there. So that's going to stretch all the way through the hamstrings. You can do that one at a time. So taking one leg up, lifting your toes towards you, and coming down. You're going to feel that again all through the hamstrings. Or you can do this obviously on the floor if you're finding it a little bit more difficult, okay? That covers the quads and the hamstrings, but then we want to also look at the hips as well. So, really the hips over here. So we want to basically open out the hips. So to do that, we can do the pigeon stretch. So coming up to something quite high, I'll show you that on the floor as well. You're going to bring your foot across at this angle here, and then what we're doing is we're coming forward. And what that's going to do is open up all through the hips there as well. You can do this on the floor as well, so if you find this one to the floor, and then you're coming over to the side. So that covers quads, hamstrings and hips. The last one is your ankle. So we want full range of movement there as well. So using something like a step, or what you're looking to do here is just drop the ankles all the way. Just do one at a time. So from there, you can just bend one knee, take it all onto this one ankle here. And then what I found is if you hitch at the hips, you push your hips back, you start to feel that come a lot higher as well. So not just your Achilles, but all the way up to your knee. So dropping down and then hitching at the hips. So in terms of flexibility, mobility, running through that kind of stretching after your run is going to be really good to help obviously loosen everything up. On top of the foam rolling, everything now is going to be a lot more kind of supple and you'll be able to move a lot more freely. In terms of mobility, mobility is essentially the joint being able to move freely, okay? So again, like I said, with the foam rolling and the stretching afterwards, it's going to help. But just in terms of before you're running, before you're going into activity, making sure that you're warming up the joints. So with the hips, we have flexion, extension, abduction, abduction, and then we also have internal, external rotation. So as long as you're taking yourself through that kind of range at the hips, then you're going to get warmed up before a run. So it's just going through that, more of a dynamic kind of mobility warm-up would be this kind of movement, and then also coming from the sides, and then opening the gate as well. So up, out to the sides, and in that kind of, I mean, this is a very quick kind of dynamic mobility that you can do before a run, but doing that on both sides, you've got to make sure that the muscles are warmed up before you go. The knee is very, very simple. We've just got the flexion and extension. So flicking up at the bum, and then you can also do kicking up as well. And then in terms of your ankles, again, mobilizing the joint before you go running. So ankle circles, pointing down and bringing up, or even just going onto your tiptoes. Okay? So, just to recap, mobility before you go for any activity, and then you've got your stretching obviously after the activity, and foam rolling is more of that kind of post-activity where you're really trying to loosen up the joints. In terms of prevention, that's the next video where we're going to talk about strengthening and stability of the joint. So in terms of strengthening the actual knee joint itself, what we were talking about before in the first video was if you're having runner's knee because of instability, which I see quite a lot, then what can happen is the knee, as it's tracking, it doesn't track up and down, and it can be pulled in different ways, and that's where you'll get that irritation. So a good way of telling if you do have some kind of instability is if, for example, you really struggle to stand on one leg, and there's a lot of this going on, there could be possible instability there. Also, another way of seeing this is if you go to do something like a one-legged squat and you really find it difficult to control your knee. And actually this is one of the things that I will have people do as well as an exercise, but it's also a really good test to see if you do have this instability. So if you come to a bench or a chair, if you sit yourself down, okay, if you come and look at me straight from the front and see the knee. So if you sit yourself down like this and then stand yourself up, I want you to do the same thing now. I just want you to sit down, but with one leg, okay? Make sure, obviously, if you are having pain at the minute in the knee, make sure that this isn't too low to start with, so this could be quite high, okay? And then from here, what you're gonna do is, make sure that's behind me, is you're gonna sit yourself down, nice and slow. One thing you might find is you start doing all this as you try to sit. That's going to be down to that instability, okay, and a little bit of weakness. Another thing you might find is you get to here, and then you just drop, and then that's obviously down to like weakness and things. But essentially what we're trying to do here is load through the knee and keep the knee forward. And then you're going to stand up with two legs, okay? So, if you find that your knee starts to pop in like this as you come down, this exercise is going to be really good to help keep it out, and that's what you're going to be focusing on when you're doing this exercise. So when you're doing it, you can start off on something a bit higher. So this, for example. Okay, and you want to go for about 5 seconds down. Okay, and the main thing is to keep the knee forward. And you stand up with 2. 6 to 8 reps, about 3 sets. Okay, as that gets easier, you can get lower and lower and lower. And essentially what that's doing is it's eccentrically loading the quads. So as the quads lengthen and take force through it, it's under control. So every time you run and you land, essentially what you're doing is this movement. So if you're someone that finds coming down the stairs, for example, quite painful, this is usually the case, is that you don't have that eccentric control, you tend to drop. And that's actually the next exercise that you'll have you doing, is a step down. So the one-legged squat that we just did is quite hip dominant. You're coming backwards, and you can see with the knee, as I kind of sit backwards, my knee isn't coming over the front of my toe. With a step down, you're loading the quad more. Yeah? So as you come, your knee goes over your toe. So with this one, again, it's causing pain. Don't push through it. On a scale of, say, 1 to 10, if you can do this and it's like a 1 or a 2, that's fine. Okay? If it's 6s and 7s, you don't want to be at this stage that you're already doing this. So essentially what you're going to do is you're going to look for that knee again and look for that control of the knee. So from here, you're going to slowly load the knee and then step down. Then you can use the banisters to step back up. Okay? Again, a couple of things you'll see. You'll just drop because of weakness, or the other thing will be your knee will start kind of going all over the place when you're trying to control it. So again, strengthening exercise, 6 to 8 reps, 3 to 4 sets. Don't do these every single day, but maybe twice a week, okay, with the single leg and the single leg on there as well. The last but not least is general balance and stability. So we have something called proprioception. We have it in all our joints, we have it in our whole body. So if I was to close my eyes, for example, and I could just touch my nose, I know where my nose is, I know where my elbow is. It's our way of understanding where things are in space without our vision. And the reason we need that is because when we're running, we're not looking at where our feet go. So now if you imagine every time you're running and you land, and your ankles are doing this, it's bringing the knee with it. So we need stability throughout the whole chain, and we need proprioception. The only way we get that is from balancing. So we can start off with things like one leg balance, and then to increase your proprioception, you do the same thing but with your eyes closed. And what you'll find is the places that start to burn, start to ache, maybe it's the foot, maybe it's the calf or the tib, or maybe it's in the glutes. They're usually the areas that you need to strengthen, and that's where you'll be getting that instability coming from. And then the back as well. Again, stability exercise, but it's also strengthening the hamstring, and it's that RDL, so Romanian deadlift, but you're going to do it with one leg. So, we'll get look at that. So, what we're looking to do, essentially, balance on one leg, and we're going to come down, so you're going to hitch at the hips, so you're not just going to drop, you push your hips back, and then you're going to come down, you're going to touch the floor, and then you're going to come back up, a lot better than that. So again, you're going to come down, touch, back up. So what you're doing again, hips, knees, ankles, they all have to be stable. And again, you're going to start to feel that burn-in, usually in the places that need a little bit more work. So that is it. That is flexibility and mobility, foam rolling to help release the muscles, and then also some strength and conditioning work that you can start doing to basically not just relieve some of the pain that you're having, but also prevent it from happening again. Because like I said at the very first video, there's a lot of different kind of angles that we need to approach when addressing runner's knee. It's not just always the fact that you've increased the volume. It could also be down to like biomechanical issues, instability, things like that. So I hope this helped, and I'll see you soon.